Hi, it's Ann from the Lowdown on Cancer, and we're beginning to look at innovations involved in diagnostics and monitoring. And, I always like to take a look at what are some of those problems and challenges with diagnostics before we jump in and look at the innovations. And so I'm very fortunate to be with my favorite radiation oncologist, Dr. Ajay Bhatnagar, and we're going to just chat for a little bit about diagnostics. And for those people who haven't been fortunate enough to see your first video that we did, Dr. Bhatnagar, would you mind kind of giving us a little bit of your background?
Yes, thanks. Well, thanks for having me on, Ann. Pleasure to be with you here today. First, as a background, I'm a practicing radiation oncologist here in Arizona. I actually have a background in biomedical engineering, as well as a business background with an MBA. I've been practicing for the past 15 years in radiation oncology, but I have also been involved in the business aspect of oncology with various startups as well. So nice to be a part of the Cancer Fund, integrating all my experiences and expertise and interests. So here I am.
Well, thank you for that. And but we're so fortunate to have you, and we're so fortunate to have you to talk with for the Lowdown community. So when we talk about diagnosis, everybody talks about how important it is that early diagnosis is the key. How does early diagnosis impact cancer plans, treatment plans, and the survival rate?
That's an excellent question. So when we talk about the flow of care in terms of patient care for cancer, it initially begins with the diagnosis. Then next stage is completing the staging workup to obtain the stage, and then we can finalize the treatment plan. And generally speaking, the earlier stages, when the cancer is still contained, within that specific site, the treatment is much more definitive and localized, resulting in a much higher success rate. And so therefore, if it's possible to diagnose the cancer at the earliest localized stages, the outcomes become that much better. And the perfect examples for that is breast cancer and colon cancer, where the diagnosis can be found in their stage 1 with over 90% cure rates for both of them.
What are the most common tools that are used for cancer diagnosis?
Usually imaging techniques. Here we have the mammogram, ultrasound for breast cancer. For colon cancer, we're imaging through a camera going through the colon, and looking at the colon through a colonoscopy, and then identifying any abnormality through the actual biopsy to officially diagnose it. But usually some sort of imaging modality. However, we are now trying to expand diagnosis beyond the imaging world through sort of genetics laboratory work that could possibly identify these tumors that we can't necessarily see so easily.
You've talked about imaging, and you've talked about some blood tests. Are there other tests for monitoring while you're going through cancer?
Yeah, at this time, it's all under investigation, but yes, there definitely are tests under evaluation in terms of genetic molecular tumor profiling. A lot of times now we would use general blood tests to understand tumor markers, but now we're trying to get in this world of personalized medicine where we're actually profiling your specific tumor and assessing how it's doing during treatment. That can give us a prognosis on how you're responding to treatment to figure out whether we should proceed in the same treatment paradigm or change to a different paradigm. So that's really where we're headed, to a more personalized treatment to your specific tumor. And that's how it's being done in terms of the genetic and genomic profiling of the specific tumor, not just your specific genetic background.
So on that genetic profiling, is that considered standard of care?
Not yet. I think it's still being valued because it means it still has to show benefits. I think in the metastatic setting, when we are trying to profile these specific tumors, you may have heard of, companies such as Foundation One, where they're really trying to identify the specific mutations or genotypes that could be amenable to specific treatments. That has definitely become a much standard option or a much standard pathway for oncologists to use for when patients are in this more advanced setting. But when we're still in this early upfront setting, the standard has not been really in place yet. But like I said, that's still the best outcome, is when we're able to identify these early. And right now, even for lung cancer, per se, the low-dose CT screening program has definitely had an impact on identifying much earlier lung cancers. And the treatments and outcome for an early stage lung cancer compared to stage 4 lung cancer is significantly different. And so that, again, is still basically with imaging. We are getting advanced imaging. I mean, historically, we tried to use a chest x-ray to screen lung cancer, and now we're doing a low-dose CT screen for lung cancer. So, I think advancements in imaging is probably the most, right now, the best advancement we have in identification of early cancers. And even with mammograms, we have better sophisticated mammograms now to help identify breast cancers, as well as artificial intelligence that can help us detect these tumors with imaging. So right now, that is the sort of paradigm of trying to improve our ability to image and visualize these tumors early on. But as soon as these tumors are diagnosed, we need to further characterize them and understand how they behave and act. And that's where this genetic profiling comes. And that's where we can sort of interject different treatments and more appropriate treatments for them to have the best outcome. So there's a difference in how we're treating these different stages, right? And so I don't know if the genetic profiling would necessarily lead to advanced diagnosis of early stage cancers versus it identifying the better and more appropriate treatment for those cancers just to clarify that. So each has its role, but right now that's where the current role is being used with imaging, identifying and screening early cancers, genetic profiling and gene sequencing to further characterize these cancers that are typically in the more advanced stage, that have already recurred and that have already been resistant to other types of treatments. So that's the current era. But everything's changing and everything's advancing.
Is that an Oncotype test, or is it a different genetic test?
Yeah, Oncotype is a type of test that is able to profile the specific tumor and determine how aggressive it is. But we've gotten even more sophisticated than Oncotype now, where that is only an 18 gene assay, we're 21 gene assay, and we have these different profiles where it looks at hundreds of genes. And other mutations to identify whether it's amenable to not only a specific type of treatment based on the specific mutation, whereas the Oncotype basically just gives a general description of how aggressive it is and whether it would be beneficial of a treatment, not necessarily a specific treatment. So the more advanced genetic profiles are becoming much more specific on a specific type of treatment it would be most amenable to.
What are some of the problems that you see with the current diagnostic tools?
Well, yeah, like I said, right now, for instance, with prostate cancer, uh, we aren't able to really image it that well and can't identify it as early as we should, in many instances. And so, but there are different ways of imaging, and nuclear medicine, such as you've heard of a PET scan, it can be helpful for different types of tumor, but there are now new markers. Instead of just using the specific sugar molecule, the FDG, there are other markers and molecules that may be better in imaging specific types of tumors, such as prostate cancer. So, we're still developing and understanding the best modalities to visualize these tumors, to identify them early on. Right now, we're just using the basic imaging standards, but that's currently all in rapid development to really individualize the specific type of imaging that would be best for that specific type of tumor. And I think that will lead to an earlier diagnosis, to an earlier stage, and a better outcome.
Is there anything else that you'd like to share that we haven't touched upon?
I'd like to touch upon that. We have made a lot of advances. If we look at the death rate from cancer, it is going down. And so there have been, and I'm optimistic that it will only continue to go down based on advancements in diagnostics. And so, there's much work that lays ahead, but, already we're seeing the benefits of what we've already established. And so the cancer rates have gone down, and mortality. And so I would anticipate that to only continue as we are able to diagnose more cancers early and earlier on and have better treatments for that. So, there's going to be improvements in all different areas of the cancer paradigm, from diagnosis to treatment. So, and follow-up care. So, it's an exciting time to be, in this world, and I am very optimistic of only better results yet to come.
Again, I want to thank you for being here and sharing your information with us. We always appreciate talking with you.
Thanks a lot, Ann.
Thank you for watching the Lowdown on Cancer presented by the Cancer Fund. To learn more about what's coming in future episodes, visit us at www.cancerfund.com. While you're there, check out past episodes and be sure to click Join Us to become a member of the Cancer Fund community. As a member of the community, you'll receive early access to new interviews as well as other announcements. Make sure to connect to all of our social media channels so you don't miss a thing. In addition to getting early access to new episodes of the Lowdown on Cancer, Cancer Fund members play a critical role in driving cancer innovation forward so that one day we can more than hope. We can actually beat cancer. Thank you for joining us on this journey.